10 considerations when choosing a doctor for your kids. The importance of having a trustworthy doctor for your kids can never be overemphasized. You do agree that the early years of your children are quite delicate. Any mistake concerning their health may be potentially life-threatening. Also, the fact that your kids can't speak for themselves makes you even more concerned. All they are given by Mother Nature is a cry, for which you must be in a position to correctly identify what exactly is hurting or bothering them. They are not like adults who can tell outright what they feel, need, or want. Even more noteworthy is the fact that most children, for various reasons, blend with whoever they feel like and reject whoever they feel is not a real friend to them. You've probably seen this with other kids you've interacted with. Try imposing anything on them and they'll throw enough tantrums to make you really regret your initial decision. As such, when it comes to choosing a doctor for your kids, you need to strike a balance between a number of factors with the aim of providing your kids with quality health care without compromising their social needs. Let's take a look at the top 10 considerations when choosing a pediatrician. Number 1, training, certification, and specialization of the doctor. Reports of poorly trained doctors jeopardizing the health of patients is not news anymore. While it's trivial to go as far as inquiring about the school a doctor received his training from, it'd be important to make sure the doctor is certified for private practice. Don't rush to make a contract with a fresh graduate, perhaps because of his youthful vigor. Once they leave school, graduate doctors are usually required to work under the supervision of seasoned doctors before they are given the power to handle patients on their own. It's during this time that they get real hands-on experience to fortify the theoretical concepts they covered in class. The certification in question depends on the country or state the doctor operates in. It pays to know the specifics of your area of residence. For instance, in the US, the American Board of Medical Specialties should be your first port of call. Is there any ABMS certified doctor near me? You wonder. That's pretty easy to know. Once you shortlist a doctor for further scrutiny, enter his first name, last name, state, and specialty on the Certification Matters website, and you'll get your answer in a spur of a moment. In addition to certification, specialization also matters a lot. Why on earth would you pair up with an optometrist to handle your child's general health problems? Of course, you need an optometrist if your child develops eye problems. But before that, the best option is a pediatrician. These specialize in the care of children aged 0 to 18 years. If not a pediatrician, consider going to a family practitioner. These are trained to take care of the whole family, including children, teens, youth, adults, and parents. Number 2, affordability. Cheap is expensive. Right? There is some truth to this statement. In that, goods and services with unbelievingly low prices have always been associated with poor quality. But that doesn't mean you spend all your hard-earned cash on overly expensive services. If you are an A-list or Hollywood actor, well and good. Go for the $300 per hour doctors. But if you are a middle income earner, try to find a perfect balance between the quality of services and the fees charged. This is popularly referred to as the best value for money. You wouldn't want to drain your wallet on doctor's fees alone. Remember, you have other things to cater for. It's advisable to properly budget your income against all family expenses so as to have a clear picture of exactly how much money you are willing to spend on health and well-being of your kids. In case your kids have special medical needs, you may have to devote a larger than normal chunk of money for their treatment. Number 3, location of the doctor's clinic. Some parents prefer a clinic that's just a short walking distance from their home so that they can access medical services when need arises. Some also prefer it that way so that saves time during clinical visits. Others like their children's clinic to be some distance from their home so as to enjoy the tour to the clinic. What's your preference? Make sure to choose a doctor whose clinic is located at your convenient location for both you and your kids. If you have a reliable personal car, consider choosing a clinic located less than an hour's drive from your home. If you use public transport, how convenient is it? Is the route busy enough that you can quickly get a vehicle to the clinic, whatever day of the time? If you've previously experienced overly long commute times due to wait times and traffic snarl-ups, know that the same may reoccur when your kids fall sick. Aside from commuting issues, choose a location that is secure enough. There is no denying that some downtown streets generally feel insecure, and in most cases, it turns out to be so. Number 4, the doctor's demeanor and communication skills. As previously mentioned, your kids need a doctor they can easily connect with. The trip to the clinic need not to be a harrowing experience for them. Consider 2 doctors, A and B. Dr. A injects your kid and he immediately screams and scrampers for safety. Dr. B gives your kids the same injection and he smiles as though nothing happened. What's magic does Dr. B possess? You've many times come across people who miraculously seem to have their own way with kids. No matter how difficult some kids seem to be, they are not able to interact with them in a manner that captivates the kid's entire being. Go for such a doctor if you can. It's only beneficial to your kids, but to you too. Chances are high that such a doctor will have good communication skills. You will feel at ease sharing with the doctor whatever hell your kid is going through. And that's usually what's needed in your child's upbringing. A problem shared is a problem half solved. Number 5, the reception staff in the doctor's clinic. In line with the doctor's demeanor and communication skills, you may also want to be sure that the people around him are equally friendly. In actual fact, you may spend less time with the doctor than you do with the reception staff. These are the guys who act as a bridge between you and the doctor. You book appointments with the doctor through them. They are the first people you meet once you get to the clinic. You make payments through these same guys. In some instances, they receive your questions before the doctor even sees them. As such, it's only safe to have the assurance that you can get along with them. In your search for the best doctor for your kids, make sure you conduct a brief survey for every clinic you shortlist. Confidently walk into the clinic. Pay close attention to how the reception staff greet you and how willing they are to help you. How does the waiting area look like? Do you feel comfortable? Or is there any air of uncertainty hovering over you throughout the stay at the clinic? How long do they keep you waiting? How clean are they? How do they respond to your inquiries? How do they release you after you are done with your surgery? If you honestly like the experience, you'll most likely enjoy every visit to the clinic throughout the coming years. Number 6, availability of telehealth services. The best place for kids to receive medical care is undoubtedly the doctor's clinic or office. However, there are some instances where your kid may need help, yet circumstances don't allow them to travel to the clinic. Take as example of what happened during the peak of the COVID-19 pandemic. Traveling was greatly restricted to help contain the virus. In such instances, telehealth will be a great option. This involves the use of interactive audio and video tools for communication between the doctor, parents, and the kids. You'll need a capable electronic device like an Android tablet or Apple laptop and compatible software such as Simple Practice to facilitate the communication. Telehealth has also come in handy in case you live in remote areas. You may not be able to travel every other day with your kids to see the doctor due to time and financial constraints, and thus you have the chance to legally skip one-on-one clinic appointments and hold the sessions from the comfort of your home. Therefore, it's an added advantage if the doctor you choose for your kids offers telehealth services. Number 7, range of medical equipment present in the doctor's clinic. You wouldn't want your kids to be tested using outdated equipment that may yield inaccurate results and even cause more health problems to them. If possible, confirm the model, status, and age of equipment your potential kid's doctor uses in the clinic. You may want to check equipment such as blood pressure kits, catheter wraps, exam tables, pediatric stirrups, otoscopes, pacemaker monitors, hospital beds, blood glucose monitors, continuous passive motion devices, exercise equipment, heat lamps, mattresses, muscle stimulators, oxygen tanks, toilet seats, ventilators, and wheelchairs, among many others. It sure sounds overwhelming, but be assured it won't be that difficult to differentiate between a well-equipped clinic and an ill-equipped clinic. Number 8, hours of operation. Up to now, there are many clinics that don't operate 24 hours a day, 7 weeks or 7 days a week. Choosing a 9 a.m. to 5 p.m. clinic may have significant implications. First and foremost, in case you work full-time, you will always have to request for some time to attend your kids' health needs. This may not always be possible, considering the pressure that usually comes with employment. If you are your own boss, the hours of operation may not be a thing of a bother to you. You usually have the freedom to do what you want, whatever time of the day or night. Also, you feel greatly inconvenienced in case your child needs urgent attention, yet the clinic is closed. No one knows when the sickness will knock your kids down. It may be in the middle of the night, in the wee hours of the morning, or right at the peak of your working shift. Therefore, choose a doctor you can comfortably see without considerably interfering with your daily schedule. Number 9, what other people say about the doctor. A doctor's reputation is very important. You'd rather be mindful of your children's well-being if you choose a doctor who's almost being deregistered due to gross medical malpractice. For yours and your kids' safety, try listening to the testimony of others regarding their experience with the same doctors. You are definitely not the first one to hire the doctor's services. Inquire from those who went before you and how they got along with the doctor. If the doctor is web savvy, you are likely to find a lot of reviews online. In the absence of online reviews, word of mouth from family and friends may help a lot. Think twice when you constantly hear bad complaints about a given doctor. Number 10, whether the doctor's clinic accepts your insurance. Last but not least, confirm whether the doctor's clinic accepts part of your medical bills to be footed by your private insurance company or other public health programs. It would be a big blow to you if you saved for years with insurers only to be told to pay from your own pocket some amount of money. Likewise, check with the doctor the range of inpatient and outpatient services eligible for payment by insurance companies. Taking all into account, it's important to choose the best doctor you possibly can for your kids so that they can grow into good health and also enjoy their childhood. Their foundation years are usually delicate and largely determined of what they'll be like for the rest of their lives. Don't take a chance for heaven's sake. By considering the above mentioned factors, you will be able to settle on a doctor that both you and your kids will forever cherish.